Chapter 2, High-Dose Vitamin C, the Ultimate Antidote. 911, help, my 10-month-old just swallowed some ... In 2009, unintentional poisoning sent over 700,000 people to the hospital. Any emergency is stressful, but few are as terrifying as finding a child lying listless beside a cabinet filled with open, overturned containers. The poison must be identified, the amount swallowed needs to be determined, and quite possibly the CDC's poison control number needs to be called. Poison-specific directions need to be closely followed, even though you might not be sure what was ingested, how much was ingested, or how long it's been since the poisoning occurred. What if there was a safe, proven, inexpensive, and exceptionally potent antidote that could immediately begin to neutralize and reverse the damage regardless of the type of poison? And what if the paramedics could administer this antitoxin even while the CDC was called and the specifics of the poison reported? There is. A quick scan of Resource H will provide a sampling of studies that show high-dose vitamin C can quickly neutralize a vast array of toxins and venoms, like drug overdoses, examples alcohol, barbiturates, amphetamines, dangerous chemicals, examples aromatic hydrocarbons, cyanides, arsenic, mercury, lead, lethal gases, examples carbon monoxide, fluorine, pesticides and herbicides, poisonous mushrooms, deadly spider bites and snake bites, radiation, examples UV sunlight, X-rays, CAT scans, nuclear accidents. Shouldn't it be available to every rescue squad and in every emergency room in the country? Unfortunately, it's not. In fact, to my knowledge, it's not available to any rescue squad or in any emergency room in the U.S. Why? Because most traditionally trained medical professionals are completely ignorant about high-dose vitamin C. This was not always true. In at least one emergency room, the one manned by Dr. Klenner in Reidsville, North Carolina, from the mid-1950s to the early 1970s, this ultimate antidote was available. Here are but a few of the many cases he reported. Pesticide exposure. 3 young boys were heavily exposed to the pesticide spray of a crop dusting airplane. The youngest boy, aged 7 years, received little exposure because the other 2 boys shielded him. The oldest boy, aged 12, was given 10,000 milligrams of vitamin C with the 50cc syringe every 8 hours. This child was discharged to his home on the 2nd hospital day. The 3rd child did not receive any vitamin C but only received supportive care. He developed a chemical burn and dermatitis and died on the 5th day of hospitalization. Black widow spider bite. In another case, a 3.5-year-old girl remembered knocking a big black bug off her stomach while playing during the day. She suddenly fell ill with a loss of appetite and a severe gripping pain in her stomach. She had nausea almost immediately and began vomiting about 6 hours later. The vomiting continued intermittently throughout the night, and after 12 hours she developed a fever. Her mother noted redness around the child's navel. There was considerable swelling and rigidity. Touching the area elicited severe pain. Over the next few hours, the child's condition deteriorated dramatically. Her speech became incoherent as she became progressively stuporous. When Klenner first saw the little girl about 18 hours after the onset of symptoms, he was able to identify the obvious fang marks of the spider bite with a magnifying glass. Klenner noted that the child was non-responsive to his questions, nearly comatose, and had developed labored breathing. Her abdomen was described as board-like. After multiple administrations of much vitamin C, some by injection and more by mouth over a period of 4 days, the swelling subsided, her appetite returned, and the girl fully recovered. Klenner reported that he had successfully treated 8 proven cases of black widow bite during his medical practice. Barbiturate overdose. Excess barbiturates in the body result in depression of the central nervous system, often resulting in death. Dr. Klenner reported dramatic success in reversing a serious barbiturate overdose with vitamin C. The patient's blood pressure had fallen to 60/0, barely alive, when he arrived in the emergency room. Immediately, Dr. Klenner administered 12,000 milligrams of vitamin C with a syringe as quickly as the vein would allow, followed by a slower intravenous drip. Within just 10 minutes, the patient's blood pressure was up to 100/60. The patient woke up 3 hours later and completely recovered, having received a total of 125,000 milligrams of vitamin C over a 12-hour period. In another case, a patient with a barbiturate overdose awoke after 42,000 milligrams of vitamin C was given by vein as fast as a 20-gauge needle could carry the flow. Ultimately, this patient received 75,000 milligrams of vitamin C intravenously and 30,000 milligrams more by mouth over a 24-hour period. Klenner asserted that the success of his vitamin C protocol in no less than 15 cases of barbiturate poisoning indicated that no death should occur in this condition. In discussing the dramatic effects of vitamin C on barbiturate poisoning and carbon monoxide poisoning, he commented that the results are so dramatic that it borders on malpractice to deny this therapy. Dr. Klenner's assertion that it borders on malpractice was much too kind. The scientifically proven efficacy of vitamin C in the treatment of severe toxin poison exposure screams criminal negligence when such therapy is ignored. But the herd mentality of most physicians provides great comfort and legal security in the world of medical incompetence. Highland moccasin snakebite. A 4-year-old girl received a full strike from a mature Highland moccasin. She immediately complained of severe pain in her leg and was already vomiting within 20 minutes after the bite. Dr. Klenner first gave her 4,000 milligrams of vitamin C intravenously. The child stopped crying within 30 minutes, took fluids by mouth, and even had occasion to laugh. She commented while sitting on the emergency room table, "Come on, Daddy, I'm all right now. Let's go home." Because of a slight fever and persistent tenderness in the leg, Klenner gave her another 4,000 milligrams of vitamin C intravenously, and finally another 4,000 milligrams late in the day. No antibiotics and no antivenin were ever given. In Klenner's words, 38 hours after being bitten, she was completely normal. In contrast, Dr. Klenner reported on a 16-year-old girl who had been bitten by a moccasin and received only accepted medical treatment. Judging from the appearance of the fang marks, he calculated the moccasin was roughly the same size as the one that had bitten the little girl. This older patient did not receive any vitamin C but was given 3 doses of antivenin. Her arm swelled to 4 times the size of the opposite arm, and she required morphine for pain control. Ultimately, she required 3 weeks of hospitalization. Dr. Klenner used high-dose vitamin C to successfully treat cases of drug overdose and miscellaneous poisonings, as well as venomous bites, for nearly 2 decades. His case studies were consistently published in peer-reviewed medical journals. Like his results with polio, Dr. Klenner's many successes using vitamin C as an antitoxin were met with deafening silence. But it's not just Klenner who has been ignored. Thousands of articles about the truly remarkable properties of vitamin C have been ignored as well, without any regard to their important relevance to modern medicine. Even worse, many supporters of traditional medicine consistently attack vitamin C. They not only belittle its value, but they also question the intelligence of anyone who would dare to promote its virtues. Unfortunately, this unforgivable and even malicious negligence means countless men, women, and children will continue to die needless and often horribly painful deaths.